everything ties in with everything else. Oral health is general health. The mouth is one of the interfaces between our bodies and our world. And if it's not functioning right, you have trouble.
There's a lot of documented research showing the relationship between dental disease and systemic disease, or dental health and systemic health.
We know every system of the body is interrelated. You know, any one system can affect another system. Your heart can affect any other part of the body. Your teeth can affect any other part of the body. You know, having infections or pain or other issues that go on. So I think it becomes real important that we take care of the whole body, every part of the body.
We know that good oral health is an integral part of overall health. It's essential to have a healthy mouth if you want to have a healthy body. And yet in Maine, there isn't a single county where there is adequate access to oral health services for all of our Maine residents. It is essential that we find a way to implement policies that will allow us to improve the ability of all of Maine's residents to have good care for their mouths.
Oral health is a very interesting contrast because illness in the mouth is one of the most prominent chronic diseases that we have, and yet it is one of the most preventable. Dentists were really among the first prevention specialists in the country with fluoridation. It was fabulous, and it's still an incredibly important public health tool.
My name's Carol Eisenberg. I'm a lawyer, but one of my first jobs out of college was working for a dental health organization, working on a fluoride study, and as part of that I did a lot of research and reading on my own too about fluoride. For every dollar we spend on fluoride, we're avoiding about $38 in healthcare costs per person. In areas with fluoridated water, the incidence of decay can be as much as 40% less than in areas without fluoridation. That's a benefit that reaches every single person regardless of their socioeconomic status, their education, whether they would take the supplements or they wouldn't. Everyone gets the benefit.
A really important policy issue, of course, is reimbursement for oral health services and dental services, because it will be hard to get people to go out to rural areas and serve the important rural parts of our state without decent reimbursement.
In a lot of Maine, the dentists are not seeing people until they are absolutely in crisis. There's so little dental care available that people aren't getting the preventive care that they need to avoid crisis, and then they end up with more serious health problems that extend beyond their teeth and gums, but affect their whole body health because they don't have enough access to dental care.
You can imagine people just in the workplace who perhaps have an abscess or a really bad cavity, and they put up with it and they put up with it because they don't have dental insurance, they aren't covered by Medicaid. And at some point it hurts too much, it affects their work too much, they take time off from work, they show up in the emergency room, and in the emergency room, which is a very expensive place to deal with anything medical or oral, all they can do is give them pain medication. They can't even fix the dental problem. So that is a real broken part of the system as far as I can see, that this person needs more appropriate care than an ER.
In the year 2014, all statistics are focusing on the fact that we are going to have more dentists that are retiring from practice than dentists that are graduating from dental school.
There are serious discussions about establishing a dental school, which is not a small issue. It will take a lot of fundraising, a lot of work, but it's very exciting.
The reason why a College of Dental Medicine makes sense for northern New England and Maine in particular is as demographics change within the state and oral health issues continue, problems continue, we're not going to have people to treat patients. And so it's a critical time for us to really be looking at tangible solutions to address a chronic problem that we anticipate is going to get worse.
And another really interesting program that has been promoted by the state and by some foundations is working with primary care physicians to have them look at the mouth as part of the body, and they are beginning to examine children's mouths and do some fluoride varnishes to improve oral health in children. So it's entering them into the continuum of oral health care where it ought to be.
We're the ones that see the kids from the first day they're born in the hospital. So we have this unique opportunity where from birth up until 2 years of age, we're actually seeing kids 10, 12, 13 or more times. So we have such a captive audience that we should be taught and we should be learning how to take care of the teeth.
All the sugar bugs. We're going to open up
Physicians are
wide.
so busy, there's so many things we have to do in the course of doing a physical exam and talk about everything about home and school and health and everything, that for us to add a little more on, we just think that you should be reimbursed. It's like a little bit of a procedure, you're doing something else, and we think for a few bucks to add on, that it's going to help people to think, well, okay, we can do this. It's one extra thing you're asking for us, but at least you're being reimbursed.
Our bodies are all interconnected, and having a chronic source of pain and inflammation in your mouth can be a significant detriment or a significant contributor to this spiral. Oral health problems, nutritional problems, behavior problems, learning problems, which can lead eventually to academic failure, high school dropouts, unemployment.
Good oral health is important to good overall health, and we owe it to ourselves as well as to every Mainer to improve access to oral health care. The policy changes that we're suggesting will help take Maine in the right direction. They're cost effective, and we can't afford not to do them.